Welcome to Monday's edition of COVID-19. After surging past 1,000 cases on Sunday, the daily tally today has dropped to the 700 mark. But authorities are warning the tally is poised to move up again as they have greatly expanded testing capacity as part of efforts to promptly identify patients. I have our consul standing by with more on the local and international fronts. Now, so let's begin with the latest here in Korea.
Sure, Sunny. Well, we are down to the triple digits again this Monday. 718 infections were reported. That's more than 300 less compared to Sunday, but we have to factor in that we had a lower number of tests conducted over the weekend. Now, 682 of today's cases were domestic infections and 36 were imported cases. Now, as for a rundown of the weekend, for the first time ever on Sunday, Korea reported a caseload above 1,000, with 1,002 of those being domestic transmissions. That is an alarming figure, but which had been predicted by health experts earlier already. Now, if we turn to our graph now, following concerns last week that we are inching close to 700, we actually made a jump to 950 on Saturday. That was already when we broke a record of the 909 cases we had earlier in February. But then on Sunday, we made another jump to above 10,000, that is. So now Korea has a total caseload of 43,484. The death toll stands at 587. And we also have over 10,000 people currently in quarantine, while 185 of those are in severe to critical condition. And that number has been rising almost every day since the beginning of this month.
Right, Swa. Now, amid those circumstances, there had been talk about raising social distancing to level 3 this past weekend, but that did not happen.
Right, Sunny. Experts are expected to make that choice. I mean, authorities will probably make that choice, of course, if they have no other choice. But as of now, officials are trying to get the situation under control while minimizing further disruptions to the nation's people's livelihoods as well as the economy. So let's hear of Prime Minister Chung Se-kyun of what he had to say about that earlier today.
We won't hesitate from taking drastic measures if we believe they're needed. Level 3 social distancing will be our last line of defense, and it requires public consensus on its necessity as well as thorough examinations. What's most important at this moment is that citizens practice the enhanced prevention measures that are currently in place.
And with that, Chung renewed his call on the nation's citizens to abide by the current social distancing levels, which are at level 2 to 2.5 across the nation. Now, 2.5 mostly in the metropolitan region, which again had the highest numbers of infections this Monday. We can see that Gyeonggi-do province had more infections than the capital Seoul this Monday, 226, and almost close to 10,000 accumulated cases. Also, most of the nation has over double-digit figures this Monday. And we also have 36 imported cases, with 17 of those detected at the nation's airport or seaports. With that, let's take a look at the overseas conditions. Still, the U.S. with the highest figure of cases at 16.7 million, followed by 9.8 million in India and 6.9 million in Brazil, and followed by a lot of European countries. Speaking of which, here another European country, the Netherlands, has joined the 20 countries with the highest numbers of infections, with almost 10,000 new cases reported in just a day. And now let's take a closer look at some specific nations here. The U.S. Still not seeing slowdowns, but with hope in sight as vaccines are expected to arrive on Monday in all 50 states. And also Germany here, with over 10,000 cases on a daily basis, has decided to get to tougher restrictions beginning Wednesday until January 10th, which means more closures of schools, daycare centers, and stores as well. Then we have Japan here with almost 3,000 infections reported in the past 24 hours. And Japan has just hit that 3,000, that record high of 3,000 cases on a day on Saturday. And now the total number of infections around the globe stands at 72.6 million. Also, we have 1.6 million fatalities. And those are the updates I have for now, but I'll be back after the government briefing. Back to you, Sunny.
All right, so thank you for now. Right, as part of efforts to promptly trace and treat COVID-19 patients, as well as those who are asymptomatic, authorities have set up temporary testing sites here in the metropolitan region. The tests are free, open to all, and simply require a contact number. I have our Chun Song-cho standing by at one such site. Hello, Song-cho.
Good afternoon, Sunny.
So which testing center are you at, Song-cho?
Well, I'm at a makeshift COVID-19 testing site in front of Seoul Station, where public health authorities have begun offering free virus tests. Currently, it's -6 degrees Celsius outside. It's freezing cold. I can't feel my fingers and toes already after standing outside for 30 minutes. However, as you can see behind me, there's a long line of people waiting to get COVID-19 tests. I think there are at least 50 to 60 people waiting in line right now. So here's one makeshift testing site, and there's another one at Yongsan Station. In fact, there are about 150 in total in Seoul and its surrounding areas, especially at places like major university districts and high-risk areas. And these facilities will be open from 9 a.m. to 6 p.m. every single day. So here, people can take the test anonymously without providing their names. That way, people don't have to worry about being stigmatized for getting the test. And also, foreigners can take the test for free as long as they have a contact number, a phone number under their names as well. And what's also different about the type of test being conducted here is that they have what's called the antigen and saliva-based test, which are considered safer and convenient, more convenient than the normal nasal swab test. Well, that nasal swab method is considered the most accurate standard COVID-19 test. However, it takes about 24 hours for the result to come out, whereas the antigen and saliva test take only about 30 minutes to 2 hours for the result to come out. But if you test positive for those tests, then you'll be instructed to take the nasal swab method for higher accuracy. Well, it's no secret that having as many people tested as possible is the key to getting back to normal and containing the pandemic spread, because that way we can identify people who are in need of care in a timely fashion, and also we can reduce the chances of having asymptomatic COVID-19 patients unwittingly spreading the virus around. So if you're feeling under the weather, or if you're suspicious of coming into close contact with anyone who has a virus, then please make use of this quick, easy COVID-19 test facility that's available for everyone. This has been Chun Song-cho reporting live from Seoul Station, and back to Sunny in the studio.
All right, Song-cho, thank you for braving the cold weather and for bringing us that report. Right, the regular afternoon briefing for this Monday has been delayed by about 10 minutes, so it will come to you, we'll bring it to you at about 2:20. Now, in response to the record rise in daily tally this past weekend, the academic arena is poised to adopt remote learning starting tomorrow. All elementary, middle and high schools will be required to engage in online classes until the 31st of December. Meanwhile, the Greater Seoul area is currently under level 2.5 social distancing, while the rest of the country faces level 2 preventative measures. Now, as we wait for the briefing to start, let's take a look at the guidelines under level 2.5 here in the metropolitan region. First, do remember that mask wearing is mandatory at all places outside of one's residence, regardless of the social distancing level amid the pandemic. Gatherings of more than 50% are banned. Such gatherings include weddings and funerals. Also, 1/3 of all public servants and workers at public entities have to work from home. Sporting events need to take place in the absence of spectators. Meanwhile, at places of worship, in-person congregation is limited to 20 people, and online religious sermons are strongly advised, while small gatherings for choir practice, Bible study and meal sharing are banned. High-risk facilities, including clubs, bars and singing rooms, have suspended their operations, while high-risk activities such as door-to-door sales are not permitted. Cycling and horse racing tracks are closed, as are cram schools and indoor sports facilities. Public facilities such as libraries and museums need to abide by an admissions cap of 30%. Other venues, such as large retail stores, are allowed to open until 9 in the evening. Restaurants are allowed to accommodate in-house diners until 9 in the evening, and after that, they can only offer takeout and delivery services. Coffee shops, meanwhile, can only do the latter, meaning takeout and delivery services. Banks in the metropolitan region will open from 9:30 in the morning and close at 3:30 in the afternoon. Separately, authorities have also called for the cancellation of all end-of-year parties at hotels and other venues. Members of the public are also being asked to refrain from social gatherings of more than 10 people. We are still waiting for the briefing for this Monday to start. We've been told that the briefing has been delayed by about 10 minutes, so it will come to you about 2:20. In the meantime, I have our Kwon with me again to give us a recap, that is, of the COVID-19 situation here in Korea this past weekend.
Well, as I just mentioned, this past weekend, let's start with the figures on Saturday. We had 950 infections on Saturday, and that was a really big jump from 689 we had on Friday. So last week we had concerns over cases rising to the 700s, but we had that sudden jump to 950 and 1,030 on Sunday. And that, although we do have a fewer number of tests, COVID-19 tests conducted over the weekend than on weekdays, although even on weekends we have more than 10,000, 20,000 tests conducted. And then we dropped to 718 daily infections this Monday, which is a drop by more than 300 infections. But again, due to that lower test number, we might see more numbers go maybe again close to 1,000 as the week progresses. Now, what is a concern right now is that the number of people in critical condition is rising as well. Every day since the beginning of December, this number has been seeing a gradual rising trend, except for one day. So that's why we are also lacking hospital beds here in the capital region. For instance, only 8, the last time I checked, beds for people in critical or severe condition are left, 5 in Seoul and 3 in Incheon. So this is why we will have to conduct much more tests this week, which is going to be done, as we saw Seongcho out there, while temporary test centers have been set up in the capital region. I think 150 was the number there. Also, officials are trying to have more hospital beds ready as well.
Right, and for more insight on the situation, I also have Dr. David Kwak from Soonchang University Hospital joining us live here in the studio. Welcome, Dr. Kwak.
Thank you.
Right, now Dr. Kwak, as our SOA has mentioned, Korea is recording daily numbers that have been unseen in the country, that is, and clearly the rate of infections is surging past that of recovery. What is the gravity of the situation, in your opinion? How grave are we looking at the situation?
Well, as the reporter Kwon mentioned, we're seeing so much increase in the numbers that the doctors in the hospitals are becoming worried that we might have to change the room situations to let out some of the people who might need treatments later, and possibly start thinking about having more COVID-19 patients admitted to the hospital. Some of the patients obviously is going to be more severely affected in comparison to the other people who are just recently confirmed. So those people will definitely need a possible critical medical care. And as it has already been reported, we're currently lacking in those numbers. We're lacking in the capacity. We're lacking in the number of ICU beds that we can provide for COVID-19 patients. Somebody has to come up really quick with the possible alternatives for those situations. But at this state, the increase in the numbers is just exceeding the capacity right now.
Right. Dr. Kwak, it's been about a week since we implemented level 2.5 social distancing for the metropolitan region and level 2 social distancing for the rest of the country. Do we need to wait longer to see the impact of these toughened measures, or are these measures proving to be ineffective?
Well, so I have a little bit of different view on that. I don't think the increase in the social distancing level to 2 or 2.5 or even to possibly 3 would affect this situation that much. It has been shown that people who became complacent still went out and gathered in family gatherings, in social gatherings, and have caused this much of a massive number already. I don't think increasing the social distancing level to for the 3 would not really mitigate the virus any stronger than the other 2 levels. That being said, really, if we're not going to lock down the country or the metropolitan completely, we still have to think about how to manage the numbers within our capacity. So it's something that could be alternative to lockdown is really having just people stay at home, not come out at all. In my mind, the only way to do that is really scaring people at this point. Show people that people are actually dying. Show people the reality of what's going on in the hospital beds. Show people the broken families. Show people the dying patient who could not have been seen by their sons and daughters for their departure to the deathbed. So that's the reality that we're facing right now. So I think that a different tactic has to be implemented at this point. Social distancing level, I'm not saying it didn't work. It obviously worked to a certain level, but at this state, in this situation, something much stronger has to be taken and implemented to nationwide.
So like starting a campaign to raise better awareness of the severity of the situation.
Right, and not just that, we really need to realize ourselves that...
Dr. Kwak, I'm going to have to interrupt you for a minute. I understand the briefing has started. We'll come back to you afterwards.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea. As of December 14th midnight, we have a total of 682 new local infections and 36 new imported cases. And the total caseload now stands at 43,484. Currently, we have 10,795 people in quarantine, and there are 185 critically ill patients. And we had 7 additional fatalities. The death toll now stands at 587, and the fatality rate stands at 1.35%. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now look through at the major updates of our domestic infections in Seoul, Gangseok district. We have the religious facility, and we have identified 25 more patients. And in total, we have 162 patients to date. And in Gyeonggi-do province, in Icheon city, in relation to an insurance company, we have 13 additional cases being confirmed. And Ansan city, in relation to a clothing facility, we also have 13 additional cases. And in Gyeonggi-do province, Sihung, in relation to the nursing hospital, 17 additional cases have been confirmed, and in total 18 have been confirmed. And 9 were users, while the other 9 were staff members. And Chungnam, in relation to Dangjin religious facility, we have 42 additional cases, and in relation to that we have 43 cases, and 38 were related to the religious facility, while 5 others were related to the senior centers. And Gwangju in Bukgu district, in relation to a religious center, we also have identified additional cases of 13, and in total we have 14 being confirmed to date. And Gwangju also, we have another religious center. We have 7 additional cases at there. And in Jeonbuk, in relation to Jeonju city, in relation to a 70th birthday, we also have the additional cases being confirmed. And in total, we have 8 confirmed cases, and among them, 7 are from one family. And in Gyeongbuk Andong city, in relation to a welfare facility, we also have identified that we have seen 12 additional patients being confirmed. And in Gyeongnam, in relation to a hospital in Miryang, we have a total of 10 cases there. And next, let us look at the past weekly risk assessment indicators and factors. And the average daily cases during the past week, we had about 662 cases, and this is compared to the previous week, more than 173 cases, and we have seen a daily rise in a 1-month period as well. And also the imported cases stands at 27%. cases, which is under the 30 mark on a daily basis. And during the past week, the major sources of infection were the contact with the previous cases, amounting to about 43.8% of the total cases. And also their contacts, in relation to their contacts, there were also from 58 were from family members, relatives, as well as co-workers. And also we have about 1,000 or 27% which are related to cluster infections. And we have 8.6% or 417 cases which are related to nursing hospitals. And we also have about 22.8% cases under investigation right now. And nationwide, we are seeing many cluster infections stemming from office spaces as well, especially at call centers and insurance companies, and they involve a use of telephone as well. And we also see many cases related to the assembly lines and the factories as well. And third, we also see continued outbreak at the nursing hospitals and clinics as well. And aside from those, we also have many other venues, including saunas, table tennis places, as well as restaurants and many other facilities. And also we are seeing an increase of the meetings and social gatherings as well. And as we saw in the case of Jeonbuk City, we are seeing family gatherings, social gatherings, and also family relatives gatherings. Also, we have the kimchi making family gatherings, which are spreading the virus at a very fast pace. And aside from those, we also see many education-related facilities, including schools and cram schools, as well as musical instrument schools, including those involving guitars as well. And during the past week, we also saw an exponential surge in the number of cases related to religious centers. And we also see military unit-based centers, the confirmed cases as well. And during the month of December, we have also seen at the cluster infections at the high-risk facilities involving nursing hospitals, especially for the elderly. And we have seen a great surge in these cases. And we see that the caregivers are also spreading this virus at these specific facilities. And epidemiological investigation shows that one of the dangerous risk factors is that we need to also get tested as soon as possible. And the time period has been delayed. So the testing has been delayed at many venues. And due to these delay in testings, these virus has been spread to many users in these facilities. And as for the nursing hospitals and care centers, many people are staying inside a room. So there are many users inside a room. And we believe that these crowdedness is also a very important factor. And we have also seen the multi-use and multi-shared facilities, including the locker rooms, especially restaurants, dining centers that are used by these caregivers, are also a source of the outbreak. And the rapid changes of these caregivers also is one of the risk factors as well. And by age group, those over the age of 60, during the past week, we have seen about 219 cases on a daily basis. And among the total cases, we have seen that compared to the previous week, we have seen a rapid increase of the proportion of the senior citizens, standing at about more than 30% during the past week. And this is also leading to an increase in the number of death tolls, as well as those in the critically ill patients. And during the past week, we have seen 31 deaths, and this is a great increase from the previous week. And 26 were related to the 80s, and also the 4 were in their 60s. And also there were many people, especially who had the underlying illnesses in the age group of 70 to 80. And the fatality rate over the age of 80 is about 15.2%. And we have seen a downward of this fatality rate, which stood over at 20%. And for the 70s, it stands at about 5.2 and about 1.6 for those in the 60s. And we believe that those in the 70s and 80s especially, we need to take particular precautions, as the fatality rate is actually relatively higher than any other age group. And by area, we also see about 546.7 or about 70% in the metropolitan area. And we also have many cases from Gyeongnam province as well. And as we saw earlier in Busan area as well, and we have many cluster infections stemming from religious facilities and nursing hospitals, and Gyeongnam as well. We see cluster infections and they have seen a rapid surge. And also we have Honam and Gyeongnam areas with over 30 cases on a daily basis, and about 3.9 cases in Jeju, and Gangwon 15 cases on a daily basis. And next we would like to go over the outbreak of the influenza virus. This is for the 49th week. So from the week of November 29th to December 5th. And out of every 1,000 outpatients, we have seen 2.8 cases, which is relatively lower than our annual average. So we do not have seen a rapid outbreak of the virus. And we have also not identified a single case of the influenza with our sample testings. And however, we have seen many detections of rhinovirus, which also is one of the cold-related viruses as well. And also in the respiratory disease hospitals, we see 0.1% of the outbreak of the influenza. Nevertheless, we believe that the influenza, especially during the weekend, can spread very fast during the winter. So we ask you to comply with the respiratory guidelines. And for those over the age of 60, and especially those who are teenagers, if you have not got the shots, please get your shots as well. And next, we would like to also look at the sources of infection by for the 10,000 cases by age group, and about majority of them were over the age group of 60s, and also we have seen 11% under the age of 19. And in particular, we have seen the younger generations from the 20s to 50 accounting for about more than 60%, and also above 60s, we have 25% as well. And looking at the sources of infection, as we said, in October and November, we have seen that cluster infections accounted for the majority, and also followed by the contact with the previous cases. And we have about 15.3% which are under investigation, and about 9.8% which were the imported cases. And as for the cluster infections, most of the sources were 21.8% were related to family gatherings and social gatherings, and about 12.9% were related to co-workers, and also 12.4% were related to nursing hospitals, and 12.3% related to sport facilities, and about 9% related to hospitals. So this means that family gatherings as well as workplaces accounted for a majority. And there were a slight difference among the age group. For those under the age of 19, obviously they had the largest spread through family gatherings, as second followed by schools and cram schools. And those in the age group of 20 to 39, we have seen the largest proportion for the family gatherings, and also second followed by office spaces, and third leisure activities, and fifth we have seen the military bases as well. And for those aged 40s and 50s, we have seen the largest proportion being the family gatherings, followed by the office spaces. And 60s, for those above the age group of 60s, we have a majority of them stemming from the nursing hospitals, followed by the exposure to the virus at hospitals and health clinics. And here, as we mentioned earlier, we see that the cluster infections is spreading very fast through many facilities and through family gatherings and office buildings, as well as many high-risk facilities. And we also see many cases which are related to the contact with the previous cases. And looking into these sources, we see that 58.2% were related to their families and these social gatherings. And first, we need to take particular precautions precautions in order to curb the virus spread through family and social gatherings. We need to cancel as much as possible these gatherings, and if you have to attend these gatherings, please wear your face mask at all times and minimize your stay at these gatherings. And also within your families, within your households, it is also very important to ventilate your space and also wear face mask if you have any suspected symptoms, and take particular precautions like getting tested as soon as possible. And if you are living with a senior citizen over the age of 60, please limit the number of visitors and also take particular precautions. And second, we have seen also the need to curb the virus within the office spaces. It is very important that we conduct the social distancing measures at the companies as well. So wear your face mask and also have non-face-to-face meetings when you have to have meetings, and also ventilate or disinfect areas, and also refrain from having gatherings and group dinings, and also have a screening of the body temperatures. So if anyone is suspected, please send this person home and get tested as soon as possible. And third, as for nursing hospital, we have said, given you the details of the risk factors, and in order to contain these virus spread, as for the caregivers, we need to highlight the importance of getting tested on a regular basis, washing your hands, and also wearing your face mask. And also we need to monitor the situations and conditions of the newly admitted patients as well as the residents there, and also limit the number of visitors. And these infectious control measures are very important and crucial. Currently, domestically, we have seen that the virus is spreading nationwide, and therefore the condition is very serious and grave. The health authorities and the public need to cooperate to overcome the virus. First, we need to conduct social distancing measures proactively. We need to also minimize the physical contacts among people, and we need to refrain from going outdoors, and also refraining from visiting crowded areas like multi-use facilities, and also cancel social gatherings and family gatherings. And also please enjoy your year-end holidays at home with your own immediate family members, and also talk to your relatives through mobile phone. And second, we need to also take particular precautions at many other multi-use facilities which are indoors, like religious centers as well as schools. So wear your face mask at all times and minimize the time of taking off your face mask, and also ventilate and wear your face mask, and also disinfect areas on a regular basis, especially those that are frequently touched by people. And third, we need to monitor the conditions, and if you have any suspected symptoms, you need to visit the screening clinic. We also have the makeshift testing sites, and also get tested as soon as possible.
네, 이상입니다. 네, 지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, that was Chong Young, Commissioner of the Korea Disease Control and Prevention Agency, with Monday's afternoon briefing. So, what was the gist of her address?
Well, let's first focus on the 7-day assessment on the virus situation here in the country. 662 cases on average domestic infections were reported in the past week. That's up by 174.3 from the previous week. And those occurred at high-risk facilities such as nursing hospitals and nursing homes, especially at locations that are shared among many people, such as changing rooms and staff lounges as well as at family gatherings and workplaces where droplet infection is more likely, such as at call centers and insurance companies. Speaking of which, also this Monday, there were new cases linked to an insurance company, as well as a factory, medical facilities, religious facilities and gatherings, welfare centers, and a birthday party as well. And the last case shows us that really we should not meet with other people and cancel any gatherings, as Tong stressed, to minimize contact with other people, even if it's relatives or family members. And especially as it looks like the number of patients aged 60 and above has risen in the past week, as that stood at 32%, while the previous week it was at 22.9%, which again means that there is a rise in people that are in serious or critical condition.
All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
확산세를 꺾지 못하면 사회적 거리두기 3단계 격상도 검토해야 하는 중대한 국면입니다. 이제 K-방역의 성패를 걸고 총력으로 대응해야 할 시점입니다.
The first vaccine will be administered in less than 24 hours.
It's been an overwhelming weekend for healthcare workers as they seek to deal with the record numbers of daily cases amid the expansion in testing capacity by authorities here starting today. Now, for more on the local COVID-19 situation, I have Dr. David Kwak from Soonchunang University Hospital, who joined me earlier ahead of the government briefing. Welcome again, Professor.
Thanks again.
Right, now, as a doctor yourself, Dr. Kwak, what concerns you most about the outbreak at this particular point? Is it the alarming surge in the caseload, or is it the presence of asymptomatic patients, or perhaps the shortage in hospital beds?
Well, actually, I'm more worried about all of those factors, but mostly I'm most concerned with the fact that the composition of the newly happening cases are now in the majority of family gatherings and workplace cluster infections. It now means that our daily life, the routines, are spreading the virus. Those are some of the things that we cannot do without. Even if we increase the social distancing level to even 3, it's not going to block a family being home together, and it's not going to block some of the people having to go to work. So we have to find a solution to how to either manage or mitigate virus spread by our daily life routines. One thing that just pops up in my mind is possibly exempting heat bills so that people will have their windows wide open at homes and in their office places, and possibly maybe banning anything to happen in underground spaces so that only people will go to places that are ventilated. But that's just my personal thought. We have to come up with a solution to how to really mitigate the virus among ourselves in our daily routines, not just the cutting corners of big social gatherings or bigger religious gatherings, because now we are in a more dire situation where it's really spreading just throughout our daily routines.
And Dr. Kwak, briefly speaking, what are your prospects for this week's infection numbers?
So I have my fingers crossed on that fact. Ever since we started seeing numbers above 600, I think people really realized that we need to be more careful. So I think since a few days have passed since we hit the number 600, that is going to show up within this week. So I think hopefully the number will stabilize within this week. And since we started hitting 1,000 or more, we've seen the city becoming completely vacant. And that'll possibly start to affect to us in about 5 or 6 days. So hopefully starting next week or so, we're going to see numbers drastically go down back to the numbers that we used to have before.
Right. Meanwhile, for now, the severity of the situation has many turning to vaccines as the answer to the raging pandemic. Authorities in the UK launched their vaccination campaign last week, while their counterparts in the US are looking to start a similar initiative this week, as early as Monday, in fact. I have David Cox, a freelance health journalist based in the UK, live on the line. Hello again, David.
Hi, Sunny. Great to be on the show again.
Right, and I also have Professor Justin Fendos from Tongso University over in Busan with us virtually as well. Welcome, Professor Fendos.
Thank you for having me.
David, we'll start with you. Tell us a bit about the ongoing vaccination campaign in the UK, including news of the 2 cases of allergic reactions and of the general public response to the vaccinations.
So right now, the vaccine is available to all care home residents, health workers and the over 80s in the UK. And so last week, thousands of people around the country received a vaccine at various hospitals. Now, as you say, there were those 2 allergic reactions. And this was not unexpected. It can happen with any new vaccine. And Pfizer's clinical trials showed that there were around 1 in 1,000 cases of people who had these allergic reactions. Now, the thing is that while these allergic reactions can be treated successfully with steroids, the problem is in the UK, there is already quite a lot of anti-vaccine sentiment. So there's some surveys which show that 1 in 3 people are exposed to anti-vaccine messages on Facebook and different forms of social media. So there are fears that amongst the wider public, there are going to be quite a few people in the coming months who do refuse to have the vaccine, which could, reduce how effective it actually is. So there's a lot of concerns about that at the moment.
I see. Meanwhile, Professor Fenders, authorities in the U.S. are also poised to use the Pfizer vaccine as well. Tell us a bit about the upcoming plan in the U.S. And if all goes according to plan, Professor Fenders, when is the U.S. likely to see the widespread effect of public vaccination?
So I think in the near term, it's important to keep the numbers in context. So the United States has a very large population, 330 million. About 87 million of these people, adults, are considered essential workers. About 52 million are seniors over the age of 60. And about 100 million or so adults have pre-existing conditions, which make them more likely to die if they get COVID. So there are large groups of people we want to get the vaccine to. And of course, being in one group doesn't prevent you from being in the two other groups. So you could have a senior who's an essential worker at the same time they have a pre-existing condition. Now, in the near term, for the next 2 months or so, Moderna has committed to giving about enough doses, vaccine doses, for about 7 million people, whereas Pfizer has committed to enough vaccines for about 12 million people. So putting that together, that's barely 19 million, not enough to cover everybody. So the right way to view this is we're in the first phase of a very long process. And there's a lot of learning that's going to be happening. So the federal government's going to be handling the distribution from the factories to the state authorities, but the state authorities themselves are apparently going to have near total autonomy in deciding how they want to distribute it within their own states. And a lot of states are already complaining about issues with storage and freezing. For instance, Pfizer's vaccine has very stringent freezing requirements. And so there's a lot of learning, a lot of things that are going to go wrong that they're going to have to learn from.
Right. David, over in the UK, what is next in the public vaccination campaign?
So the government's timeline is quite ambitious. So they basically want to vaccinate all at-risk people by the end of April. So that's basically like the elderly and everyone with underlying healthcare conditions. Now, at the moment, like they're vaccinating, it's the over 80s and healthcare workers and also care home residents. That's about 4.5 million people. But at the moment, the main limiting factor is the amount of doses available. So Pfizer has been struggling with making enough doses of a vaccine available. So the UK has enough at the moment for just 400,000 people. So the key things to really observe in the coming weeks as to whether the other vaccines, like the Moderna vaccine and the AstraZeneca vaccine, get approved. So these are currently being considered by regulators. And if they do get approved, then many, many more millions of doses could become available, which could really accelerate things in the coming weeks. So that's basically what we're waiting for at the moment in the UK.
Right. Hopefully all things will work out. Now, Professor Fenders, David mentioned this earlier, but how do you, or what do you propose to deal with the rising public skepticism over COVID-19 vaccines?
So in the U.S., actually, there's good news and there's bad news. The good news is that skepticism has actually been on a pretty steady decline since the summer. So during the summer, the U.S. surprised everybody with only about 50% of people saying, yes, I would be willing to get a vaccine. But in recent weeks, we've seen through Pew and through Gallup that that number has steadily increased to something between 60 and 68%. The bad news is most of this change in opinion has happened because people have now had direct experiences, or in some cases indirect experiences with the virus. So there are people that they know who've died, or people that they know who've gotten sick. And so that probably is the ultimate PR communication strategy, that if people see it with their eyes and have actually know someone who got it, that is probably the biggest motivator to getting the vaccine. So I would agree with what Dr. Kwok was saying earlier, that showing people what's going on and seeing what it's like in the hospitals and how overworked the nurses are and how people are suffering, that might actually be the most effective PR strategy.
Right. All right, Professor Fenders, thank you very much for your insights. And David, over in the UK, thank you very much for making the time to join us live at this hour.
Thank you.
Thank you.
Right, meanwhile, back here in the studio, Dr. Kwok, here in Korea, authorities are speaking of vaccinating 44 million people starting from the second half of next year. Now, given the alarming situation right now, some are claiming that the government needs a more aggressive stance towards securing vaccines. What are your thoughts?
Well, I agree with that idea because it's the time urgency that we have at hand. If we spend enough time and wait until last of the next year to start vaccinating, I am about 50% positive that it's going to be over with already. The vaccinations will not have a positive effect on us and will give protection for us. We need to get something really quick and start vaccinating people right away here. So I think the government has to broaden their prospects and broaden their options of vaccinations and possibly look into other companies and other companies from other countries as well, and demand from them possible formal results and formal study results so that they can make quick decisions as to how we're going to implement vaccinations for ourselves as soon as possible.
Right. Doctor, a few words about the safety precautions that members of the public should take this week.
Right, as I said, keep the 3 W's, but at this time, it's not for the country, it's not even for the country's sake, it's for our own sake. We need to go into a survival mode. So watch your distance, wear your mask, and wash your hands properly.
Right, Dr. Kwok, as always, thank you very much for your thoughts.
Thank you for having me.
Right, and on that note, we end Monday's edition of The Pandemic. We'll be back tomorrow with more on efforts to contain COVID-19. In the meantime, do seek to stay safe. Thank you for watching.